Medicine has to be something you want to do and not something that someone asks you to do. If not, you're going to flop big time. Hi everyone, welcome back to my channel. If this is your first time tuning in, thank you for coming here. And if this is not your first time tuning in, I'm glad to have you back here again and again and again. You are so welcome. So my name is Agnes and I'm a medical student studying in Russia. I'm in my 4th year. And yeah, in today's video I'm going to be talking about 10 things I wish I knew before studying medicine. If this is a topic that you'll be interested in knowing more about, please stay tuned and watch to the end, okay? It promises to be very enlightening and also entertaining. So yeah, let's get right into it. So the first thing I wish I knew was the real number of years it takes to become a real doctor. Like, you know, before you start studying medicine, people just say it's just a 6-year course. Like, you can just go and study medicine for 6 years and then you become a doctor. It is not like that. No. After 6 years, you still have to go for a bit of practice, write exams before you actually become a real doctor, not a quack doctor. Because if you're going to be a quack doctor, you don't need 6 years to become a doctor, but then it takes close to about 8 to 10 years to actually become a solid doctor. So yeah, if you're going to study medicine, that should be the first thing that you keep in mind, the real number of years, not the paper number of years, okay? The second thing I wish I knew was that medicine can sometimes be very irritating. Like, people just know medicine as medicine in general, but there are different sides and different aspects to medicine. When we talk about medicine, there is, let's say, pediatrics, for instance, let's say urology, traumatology, orthopedics, otolaryngology, cardiology, and audiologists. There are all those things. So for each system of the body, there is like a doctor of there's a specialized doctor in that system of the body. For instance, let's say the eyes now, there is an ophthalmologist. Teeth, there is a dentist. So there are some parts of medicine that are really irritating. For instance, dermatology. Oh. I was eating the ice cream you saw me eating, and I was planning, like, I wanted to start studying. The cycle I'm having, as I said previously, is dermatology. I just opened the material. I won't show it because I know that some people are like, they have some phobias of some kind of things and they won't want to see it. But then I just saw some pictures. Dermatology is it's irritating. I don't like that. I can't be a dermatologist. I don't like it. You just be seeing people's God, Jesus. I just closed the PDF and said, okay, let me finish eating before I'll start studying again. It was not nice. The things that you'll be seeing, they are not nice. Like, they are not pleasant to the eye at all. Holy Spirit. That's one course, like, we call it circles because we do them in like weeks. So maybe for 2 weeks you're doing dermatology as a circle, for 2 weeks you're doing pediatrics as a circle, for 2 weeks you're doing one course as a circle, like that. So when we're doing dermatology, when I'm reading the material, if I'm reading the material and I just see like the pictures of all those diseases, skin diseases, man, I'm not kidding you, it is irritating, very irritating. So you have to prepare your mind that you're going to see some kind of things that are really just prepare your mind. Then the third thing I wish I knew was that 90% of the things you're going to do in medical school is going to be self-taught. What do I mean? I mean that you're going to, like, the bulk of the work is on your shoulders. So your teachers are not basically teaching you anything. They are only coming to come and assess what you know. So if you're going for a class, for instance, they're just coming there to come and ask you. They assume you know what you're coming to come and do in the class already. And for me, I feel like that thing is very painful, because teach me, let me know what I'm doing first, at least, before you ask me. So when it comes to practical skills, and they have not really taught and they are asking questions, that thing can be very painful. So 90% of the things you're going to be doing, you're going to learn from YouTube, you're going to do your research, you will learn. You will learn by yourself. The fourth thing I wish I knew was that the exams never really end. Wow. For every stepping up you want to do as a doctor, there is an exam to take. Like, that means when you graduate and you are already a doctor, you will not stop reading. No. You will still continue reading and reading. And I don't mean read for 1 hour, read for 2 hours. Like, the exams never really end. They never end. They will be getting worse and worse. Because, like, every time there is always an exam to write, okay? So you just have to prepare your mind that till you become, I don't know, after, what's the highest form? PhD. Till you get to that level or you pass there, you're going to keep writing exams and exams and exams and exams. So prepare your mind, okay? The fifth thing I would say is that some courses don't have materials. Yes, and you are expected to know those courses. That's amazing, right? I don't know how we are doing a course in school and there's literally no textbook, no material. How do they expect me to study and prepare for that course? Please, have you been in that? If you have been in such a situation, comment in the commentation box and tell me, yes, there are some courses that don't have materials. It's very amazing. There are some courses you are doing in medical school does not have materials. I'm like, okay, so what am I supposed to be doing? Like, what should I be doing? How do I prepare for the class? How do I study? I should just go with my brain, and they will ask you questions. It is well. The sixth thing I wish I knew was that you need strength to study medicine. You need mental strength, emotional strength, physical strength, and all the strengths. Brain strength, yes. Because you need strength to study medicine. Like, strength in all aspects of your life. See, currently in this semester in school, our classes start by, for fourth year or not, first year is the worst. Third year, no, I don't know if first or third year is the worst. I don't know which of them. Third year. I remember my third year. If you want to watch, like, my third year medical experiences on the channel, I'm going to link it up somewhere here. So you can click and watch it after you finish watching this video. Medicine has to be something you want to do and not something that someone asks you to do. If not, you're going to flop big time. It's something that you have to be thinking about your future patients for you to be able to study, because sometimes it actually gets really tiring. It gets really tiring. Plus, some teachers can be like, they can be really, really annoying. You need to gather all your strength. Mentally, physically, you're going for classes every day, you're coming back late, you still have to study, you have to cook, you have to eat, you have to rest, you have to sort for materials, you have to wash your clothes, you have to do... Why am I complaining? This is what I wanted to do, right? Yeah, I'm doing what I want to do. That's why I said, it has to be something you want to do, not something that... Don't allow anybody to force you to do medicine. If your parents told you that you must become a doctor for them, that's calm. It's calm number one. Don't allow anybody to pressure you into studying medicine. See, do your research, do it very, very well before you jump that you want to do medicine. It's very good that people are going to be calling, hey, Dr. Agnes, Dr. AG, Aggie Fire. It's sweet, but behind all those honorarium, behind all that honor, there is a lot of hard work and a lot that goes into it. Most of the times, the people in medical school, the doctors that are doctoring you, they are depressed because of what they are going through in their academics. So you have to be sure that you want to do it. I think I'm on the 7th point now. So the 7th point I'm going to be saying is that you're going to be invading people's private parts and you have to be ready. Hey, Jesus Christ. Oh, I remember the first day I had to give injections and they were male patients. So that means I have to touch their bum when I'm giving intramuscular. God, what am I laughing? When I'm giving intramuscular injection, I was like, wait. And some patients will not even mind. They will just drop their pants in front of you. They'll just drop their trousers. I'm like, you are not even shy that somebody is there. You are not ashamed. Me, I am shy on your behalf. But like, you just have to get used to it, that you're going to be seeing people's private parts. And that means that means you need to have self-control. You should not be somebody that once you see someone's nakedness, your mind is running wild. So put that into consideration. And if you're already a medical student and you need help in that area, better pray to your Master Jesus to give you self-control, because some doctors can be, especially, what are they called? Gynecologists. Let's not talk about it. The 8th point I will be giving is that if you're going to study in a cold country, then you should come ready to be disciplined and do what you need to do. Because, for instance, here in Russia, it's really cold. So most of the times, the weather is cloudy. And when it's cloudy, all you want to do is what? Sleep. But you have to be able to put yourself under the mentality that you have to go for your classes, you have to be in the hospital, you have to put in the work and get your degree. So be ready to be disciplined if you're going to become a medical doctor. Okay. Number 9, come ready to read. Be ready to study. Be ready to read. Except you don't want to be a good student. But if you're going to be a good student, you are going to read. Like, read. Real reading. You read. That's just the point. You read. So come ready to read. The 10th and final point in this video is, can your brain carry it? That's a question. Can your brain really carry the medicine? Can you carry it? One material can be so vast for only one course. And you have to read plenty. So you have to ask yourself, is my mental capacity par on par with the medicine I am about to study? It should not be something that you will be struggling, because honestly, it's not because you were taking first in secondary school, you were taking first in primary school, that you will now jump up and say you are going to study medicine. It's not like that. No. You are like, I feel like an average person could actually study medicine in all seriousness. It just depends on how much effort you put into it. If you put in the work, you're going to find it easier. So yeah, that brings us to the end of this video. If you watched up to this point, please like the video. Tell me what points stood out to you. And if you're a medical student, I'm saying hi. If you're not, thank you for watching still. And yeah, tell me what points stood out to you. Let's have a conversation in the conversation box, in the comment box rather. Like, do you want to study medicine? What's your purpose for watching this video? Where are you watching me from? If you're watching from Calabar, Nigeria, tell me. I'm watching from Calabar, Nigeria. But yeah, guys, I love you guys and I miss you already. I'll see you guys in the next video. Thank you guys so much for watching. Bye-bye. Come and see, oh, come and see. Be as comfortable as you can be. Okay? Okay, 1, 2, 3, go. Hi everyone, welcome back to my channel. If this is your first time tuning in, thank you for coming here. And if this is not your first time tuning in, I'm glad to have you back here again and again and again. You are so welcome. My name is Agnes and I'm a medical student studying in Russia. I'm in my 4th year. And in this video, I'm going to be talking about 10 things I wish I knew. That was smooth, but you just have to do it again, okay? Right. 1, 2, 3, 4, 5, 6, go. I don't want to say medical school will stress you, but